everyone. So the question today is, I am done with my nurse practitioner program. What next? This is a tricky question because what one person does will not necessarily work for another person. However, I am going to discuss what I think can happen based on my own experience as a recent graduate from a nurse practitioner program. So, first question, how long do I need to study? This is relative. It depends on your speed of comprehension. When I was trying to find out or get an idea of how long I need to study for me to do well, I saw various people talking about their own experiences, and everyone had a different opinion. One person said, I studied for 3 months. Another one said 2 weeks. Another one said 1 month. Another one said 2 days, 48 hours. That inspired me. I'm one person who wants to do things and be done with them. I don't want to waste time studying for months and months. So when I saw 2 days, I was like, if somebody can do it for 2 days, I can do it in as little as 2 weeks. So I did study for 2 weeks and then took my NP exam, and I did pass the first attempt. So the question of how long to study is a personal thing. You cannot necessarily do what somebody else has done, or you cannot rely on someone else's own experience. When do I take the exam? I honestly recommend taking your exam as soon as you're done with school, or the soonest possible, so you can study while you are still going through your program, or you can decide as soon as you graduate to focus on studying quick and doing your exam. Why? Because your knowledge is still fresh. You have a lot of material fresh in your mind. You don't want to wait until you forget and then you go to take your exam. You'll find yourself having to do double studying. What materials are best or most recommended for studying? There are so many materials out there for studying. Question banks, videos, crash courses. I personally took Sarah Michelle. Not that I am sponsored by anyone here, but I know so many of my friends have used Sarah Michelle. I also know out there is UWorld, there's APEAs, there's Dr. Fitzgerald. There's so many different materials that you can use to study. I use Sarah Michelle. She has a very good crash course in question banks, and I only used those materials and they worked out for me. So it depends on you, your mode of study, and what works best for you. How did I do it? I liked her videos so much, so I would watch a video 2 times. By the 3rd time, I am chanting the answers and they are sticking in my mind, because quite unfortunately, unlike other exams that you can do or other tests that you can do and just be done with them, you need to know your content, because you are going to be, dealing with people, treating people. You have to remember your content. You have to remember your materials. You need to have a knowledge of what you're going to do. So this is not something you can do passively. So my own experience is, don't rely necessarily on what people can do or what they said they did. You do what works best for you. You can study 2 days, 2 weeks, 2 months, 3 months. I did 2 weeks and I passed. Someone else did 1 month and they did not pass. Someone else did 3 months, they passed. Others did. People are different. That's what I can say. Thank you so much for watching. Please look out for another video that explains the difference between AANP and ANCC exams coming soon. Don't forget to like and subscribe. Thank you. Have a good night.